NURS 65, 21 Final Exam, NURS 65, 21 Advanced Pharmacology Question 1. What is not considered an effect of opioids? A. Cough suppression. B. Nausea. C. Increased heart contractility. D. Constipation. E. Sedation. The correct answer is increased heart contractility. Question 2. A 45-year-old patient with a history of anxiety presents to the clinic with complaints of excessive worry, restlessness, and muscle tension. Which class of medications primarily works by increasing the frequency of chloride flow through GABA A receptors to alleviate these symptoms? A. Antidepressants. B. Antipsychotics. C. Benzodiazepines. D. Antihistamines. E. Anticonvulsants. The correct answer is benzodiazepines. Question 3. What is the mechanism of action of diazepam? A. Diazepam interacts with the GABA A receptor to increase the frequency of channel opening. B. Diazepam interacts with GABA B receptors to inhibit G protein-coupled receptors. C. Diazepam acts as an agonist of the acetylcholine receptor. D. Diazepam interacts with the GABA A receptors to increase intracellular sodium. E. Diazepam interacts with GABA B receptors to inhibit adenylyl cyclase. The correct answer is diazepam interacts with the GABA A receptor to increase the frequency of channel opening. Question 4. Which medication significantly increases the risk of serotonin syndrome if co-administered with a selective serotonin reuptake inhibitor? A. A glucocorticoid. B. A beta blocker. C. A monoamine oxidase inhibitor. D. A nonsteroidal anti-inflammatory drug. E. Aspirin. The correct answer is a monoamine oxidase inhibitor. Question 5. Which of the following statements is true about flumazenol? A. It binds at a similar site to the benzodiazepines. B. It is a GABA A agonist. C. It is an agonist to benzodiazepines. D. It is a reversal agent for alcohol intoxication. E. It is used in the management of alcohol withdrawal. The correct answer is it binds at a similar site to the benzodiazepines. Question 6. Which of the following is a mechanism of action of bupropion? A. It is an antagonist of nicotine receptors. B. It selectively induces noradrenaline reuptake. C. It selectively induces dopamine reuptake. D. It inhibits noradrenaline release from the presynaptic neuron. E. It inhibits dopamine release from the presynaptic neuron. The correct answer is it selectively induces dopamine reuptake. Question 7. Which oral antiviral medication, known for its high oral bioavailability, is preferred for genital herpes because it can decrease the duration of symptoms and prevent the recurrence of new lesions? A. Valacyclovir. B. Acyclovir. C. Famciclovir. D. Ribavirin. E. Oseltamivir. The correct answer is valacyclovir. Question 8. What is the best initial treatment for a premenopausal woman who is found to have a mild microcytic anemia and low iron studies? A. Oral iron supplementation. B. Intravenous iron dextrin. C. Oral folic acid. D. Vitamin B12 injections. E. Blood transfusion. The correct answer is oral iron supplementation. Question 9. Which of the following medications is generally recommended as the initial pharmacotherapy for active rheumatoid arthritis? A. Prednisone. B. Acetaminophen. C. Indomethacin. D. Hydroxychloroquine. E. Methotrexate. The correct answer is methotrexate. Question 10. Which condition is frequently treated with trazodone? A. Erectile dysfunction. B. Smoking cessation. C. Hypertension. D. Seizure. E. Insomnia. The correct answer is insomnia. Question 11. During a flare of gout, what are the preferred treatment options? A. Use of opioids for pain management during the flare. B. Initiate uric acid reduction therapy immediately during the flare. C. Treating the flare with colchicine as the first choice of medication. D. NSAIDs or corticosteroids. E. Employ dietary modifications without medications during the flare. The correct answer is NSAIDs or corticosteroids. Question 12. Which of the following is not a plasminogen activator? A. Diperamidol. B. Factor XIA. C. Urokinase. D. Kallikrein. E. Streptokinase. The correct answer is diperamidol. Question 13. How does decreasing dopamine levels in the chemoreceptor trigger zone affect nausea and vomiting? A. Decreases nausea and vomiting. B. Increases nausea and vomiting. C. Has no effect on nausea and vomiting, but causes dizziness and lightheadedness. D. Affects nausea, not vomiting. E. Causes anorexia. The correct answer is decreases nausea and vomiting. Question 14. A woman with frothy, foul-smelling vaginal discharge, urinary discomfort, and a strawberry cervix on exam is found to have motile trophozoites from a cervical swab. What is the recommended treatment based on the likely diagnosis? A. Prescribe metronidazole for both the patient and all of her sexual partners. B. Prescribe metronidazole for the patient only. C. Prescribe fluconazole to the patient and recommend sexual abstinence to her partners. D. Prescribe doxycycline for both the patient and all of her sexual partners. E. Recommend over-the-counter antifungal creams for the patient and advise her partners to seek individual evaluation. The correct answer is prescribe metronidazole for both the patient and all of her sexual partners. Question 15. What is a common indication for doxycycline? A. AIDS. B. Rubella. C. Meningitis. D. Acne. E. Hypertension. The correct answer is acne. Question 16. A 50-year-old man with a history of depression began treatment with a monoamine oxidase inhibitor concurrently with a tapering schedule from a selective serotonin reuptake inhibitor. 6 hours post-administration of the MAOI, he exhibits tachycardia, elevated body temperature, and signs of confusion and agitation. What is the most important step in management? A. Implement supportive care. B. Cease administration of both the SSRI and the MAOI immediately. C. Administer benzodiazepines for sedation. D. Administer serotonin antagonists. E. Increase hydration with intravenous fluids. The correct answer is cease administration of both the SSRI and the MAOI immediately. Question 17. A 35-year-old patient with a history of depression and a smoking habit presents to the clinic. They express a desire to quit smoking. Which antidepressant could be considered as an appropriate treatment option for this patient, given their history of depression and smoking? A. Bupropion. B. Mirtazapine. C. Amitriptyline. D. Paroxetine. E. Duloxetine. The correct answer is bupropion. Question 18. Which of the following drug classes may show a procoagulant effect? A. Direct thrombin inhibitors. B. Vasopressin agonists. C. Fibrinolytics. D. Adenosine diphosphate. Receptor inhibitors. E. Phosphodiesterase inhibitors. The correct answer is vasopressin agonists. Question 19. What resistance mechanism have Enterobacteriaceae developed against macrolides? A. Adding a methyl group to change the binding site. B. Potentiation of CYP450 enzymes. C. Ejector pumps. D. Beta-lactamases. E. Drug-destroying esterases. The correct answer is ejector pumps. Question 20. Which patient population is at the highest risk of experiencing seizures when prescribed a tricyclic antidepressant? A. Individuals with hypothyroidism. B. Patients with a history of migraine headaches. C. Individuals with chronic alcohol use disorder. D. Individuals diagnosed with essential hypertension. E. Patients with type 2 diabetes mellitus. The correct answer is individuals with chronic alcohol use disorder. Question 21. What is true about ADHD treatment? A. Antipsychotics are considered first-line treatment for ADHD. B. Alpha-2 agonists can be used to treat ADHD. C. Norepinephrine reuptake inhibitors are approved in treating ADHD in children under 6 only. D. There is no medication that has proven effective at treating ADHD symptoms. The correct answer is alpha-2 agonists can be used to treat ADHD. Question 22. How long does the antiplatelet function of aspirin last? A. 3 to 7 days. B. 3 to 7 weeks. C. 1 day. D. 14 days. E. 3 to 7 hours? The correct answer is 3 to 7 days. Question 23. Which drug is incorrectly matched to its target receptor? A. Baclofen, gamma-aminobutyric acid B receptor. B. Cyclobenzaprine, muscarinic acetylcholine receptor. C. Diazepam, gamma-aminobutyric acid A receptor. D. Tizanidine, alpha-2 receptor. E. Tizanidine, alpha-1 receptor. The correct answer is tizanidine, alpha-1 receptor. Question 24. Which statement best describes the mechanism of action of macrolides, like azithromycin? A. Inhibition of protein synthesis by binding to the 50S ribosomal subunit. B. Inhibition of bacterial cell wall synthesis by binding to penicillin-binding proteins. C. Inhibition of protein synthesis by binding to the 30S ribosomal subunit. D. Inhibition of nucleic acid production by blocking folic acid synthesis. E. Inhibition of nucleic acid synthesis by blocking DNA-dependent RNA polymerase. The correct answer is inhibition of protein synthesis by binding to the 50S ribosomal subunit. Question 25. Why are chlordiazepoxide and diazepam preferred benzodiazepines for alcohol withdrawal management? A. They are long-acting, providing a self-tapering effect. B. They are short-acting, reducing the risk of accumulation and overdose. C. They enhance GABA activity more selectively than other benzodiazepines. D. They are more potent at the GABA receptor than other benzodiazepines, making them effective at lower doses. E. They have minimal effect on liver enzymes, making them safer for patients with liver impairment. The correct answer is they are long-acting, providing a self-tapering effect. Question 26. What is the mechanism of action for eptifibatide? A. Glycoprotein IIB3A receptor antagonist, reversibly inhibiting platelet aggregation and adhesion. B. Cyclooxygenase 1 inhibitor, irreversibly inhibiting platelet aggregation. C. Increases the conversion of plasminogen to plasmin, promoting the breakdown of fibrin clots. D. Direct thrombin inhibitor, preventing the conversion of fibrinogen to fibrin. E. P2Y12 adenosine diphosphate receptor antagonist, irreversibly inhibiting platelet aggregation and activation. The correct answer is glycoprotein IIB3A receptor antagonist, reversibly inhibiting platelet aggregation and adhesion. Question 27. Which change is likely with the administration of dipyridamole? A. Increase in platelet CAMP levels. B. Inhibition of adenosine deaminase. C. Inhibition of the cellular reuptake of adenosine. D. All changes listed are likely. E. Inhibition of phosphodiesterase. The correct answer is all changes listed are likely. Question 28. Which anticoagulant is noted for being able to bind clot-bound thrombin? A. Unfractionated heparin. B. Phosphodiesterase inhibitors. C. Hirudin. D. Warfarin. E. Cyclooxygenase inhibitors. The correct answer is Hirudin. Question 29. What is not a side effect of morphine? A. Hypotension. B. Respiratory depression. C. Nausea. D. Renal calculi. E. Constipation. The correct answer is renal calculi. Question 30. What is a feature of tricyclic antidepressants? A. Dialysable. B. Lower seizure threshold. C. Insignificant first-pass metabolism. D. Low side effect profile. E. Low volume of distribution. The correct answer is lower seizure threshold. Question 31. Which of the following medications reversibly inhibits the adenosine diphosphate receptor? A. Ticagrelor. B. Clopidogrel. C. Prasugrel. D. Ticlopidine. E. Tirofibin. The correct answer is Ticagrelor. Question 32. Which procoagulant therapy exerts its effect by inhibiting plasminogen activation? A. Idarucizumab. B. Fresh frozen plasma. C. Vitamin K. D. Octaplex. E. Aminocaproic acid. The correct answer is aminocaproic acid. Question 33. Which step do aromatase inhibitors prevent in the synthesis of estrogen? A. Conversion of androstenedione to estrone. B. Conversion of pregnenolone to progesterone. C. Conversion of androstenediol to testosterone. D. Conversion of dehydroepiandrosterone to androstenedione. E. Conversion cholesterol to pregnenolone. The correct answer is conversion of androstenedione to estrone. Question 34. What is an important drug-drug interaction to be aware of when prescribing linezolid? A. Serotonin syndrome when combined with selective serotonin reuptake inhibitors. B. Gastrointestinal bleeding when combined with nonsteroidal anti-inflammatory drug. C. Reduced effectiveness when combined with benzodiazepines. D. Hypotension when combined with antihypertensive drugs. E. Hypertensive crisis when combined with tricyclic antidepressants. The correct answer is serotonin syndrome when combined with selective serotonin reuptake inhibitors. Question 35. A nurse practitioner prescribes amitriptyline, a tricyclic antidepressant, to a patient for the management of neuropathic pain. The patient returns complaining of dizziness and lightheadedness upon standing. Which of the following mechanisms is most likely responsible for these symptoms? A. H1 antagonism. B. Alpha 1 receptor antagonism. C. Alpha 2 receptor antagonism. D. Serotonin reuptake inhibition. E. Muscarinic receptor antagonism. The correct answer is alpha 1 receptor antagonism. Question 36. Which item is not an opioid analgesic? A. Opium. B. Fentanyl. C. Naloxone. D. Synthetic opiates. The correct answer is naloxone. Question 37. The 3 C's of tricyclic antidepressant toxicity include which of the following? A. Confusion, constipation, and cataracts. B. Cramps, cough, and cutaneous reactions. C. Chest pain, cyanosis, and clonus. D. Coma, convulsions, and cardiotoxicity. E. Cachexia, cholestasis, and cellulitis. The correct answer is coma, convulsions, and cardiotoxicity. Question 38. What is the mechanism of action of rituximab? A. Inhibitor of MAP kinase. B. COX-1 inhibitor. C. Monoclonal antibody to CD20. D. COX-2 inhibitor. E. Monoclonal antibody to CD19. The correct answer is monoclonal antibody to CD20. Question 39. Which medications are most effective in treating benign prostatic hypertrophy? A. Alpha 1 adrenergic agonist and a beta 2 agonist. B. 5-alpha reductase inhibitor and calcium channel blocker. C. 5-alpha reductase inhibitor and nitroglycerin. D. Alpha 1 adrenergic antagonist and a 5-alpha reductase inhibitor. The correct answer is alpha 1 adrenergic antagonist and a 5-alpha reductase inhibitor. Question 40. What is an indication for idarucizumab? A. Reversal of the anticoagulant effects of dabigatran. B. Reversal of procoagulant medications. C. Prevention of warfarin-induced skin necrosis. D. Prevention of heparin-induced thrombocytopenia. E. Reversal of the anticoagulant effects of heparin. The correct answer is reversal of the anticoagulant effects of dabigatran. Question 41. What is a possible mechanism of action of lithium? A. Reduction in plasma GABA levels. B. Reduction of inositol triphosphate. C. Decreasing the availability of glutamate in postsynaptic neurons. D. Inhibition of G protein-coupled receptors with increased production of cyclic AMP. E. Reduction in intracellular calcium. The correct answer is reduction of inositol triphosphate. Question 42. What types of organisms are targeted by 4th-generation cephalosporins, but not by 1st-generation cephalosporins? A. Gram-positive bacteria. B. Gram-negative bacteria. C. Bacterial infections of the brain and spinal cord. D. Intracellular bacteria. E. Beta-lactamase-producing bacteria. The correct answer is gram-negative bacteria. Question 43. Which statement about aminoglycoside toxicity is incorrect? A. Gentamicin is associated with ototoxicity. B. Neomycin is the treatment for aminoglycoside-induced neuromuscular blockade. C. Skin reactions are usually associated with the use of neomycin. D. Amikacin is responsible for the auditory deficit. E. Tobramycin is associated with vestibular ototoxicity. The correct answer is neomycin is the treatment for aminoglycoside-induced neuromuscular blockade. Question 44. A 35-year-old patient with a history of bipolar disorder presents with symptoms of mania, including elevated mood and excessive energy that are interfering with his life at home and at work. Which medication is commonly used to treat the manic phase of bipolar disease by reducing synaptic release of amines and requires monitoring of plasma levels for 4 weeks when initiating therapy or changing the dose? A. Carbamazepine. B. Clonazepam. C. Lithium. D. Olanzapine. E. Valproic acid. The correct answer is lithium. Question 45. Resistance to tetracyclines by Proteus and Pseudomonas species is due to their possession of A. Multi-drug efflux pumps. B. Overexpression of protective enzymes. C. Enhanced bacterial cell wall impermeability. D. Increased production of beta-lactamases. E. Altered ribosomal binding sites. The correct answer is multi-drug efflux pumps. Question 46. What is true about treatments for opioid use disorder? A. Goals for treatment include decreased opioid use and increased social functioning. B. Narcotics Anonymous is an inpatient, physician-led program. C. Benzodiazepines are first-line treatment. D. Studies show that behavioral therapy alone shows the best treatment outcomes. The correct answer is goals for treatment include decreased opioid use and increased social functioning. Question 47. To what class of molecules does heparin belong to? A. Proteins. B. Monosaccharides. C. Lipoproteins. D. Mucopolysaccharides. E. Lipids. The correct answer is mucopolysaccharides. Question 48. What is most accurate regarding fentanyl? A. It has a long duration of action. B. It is not used as a recreational drug. C. It is about 80 times more potent than morphine. D. Fentanyl is not appropriate for sedation in the ICU. E. Fentanyl should not be co-administered with midazolam. The correct answer is it is about 80 times more potent than morphine. Question 49. Tazobactam is A. Penicillin binding protein inhibitor. B. Beta-lactamase sensitive penicillin. C. Beta-lactamase inhibitor. D. Dehydropeptidase inhibitor. E. Aminopenicillin. The correct answer is beta-lactamase inhibitor. Question 50. Which statement about penicillins is false? A. Oxacillin is a narrow-spectrum penicillin. B. Ticarcillin is contraindicated with administration of aminoglycosides. C. Methicillin is associated with interstitial nephritis. D. Nafcillin is associated with neutropenia. E. Ampicillin is a wide-spectrum antibiotic that is susceptible to beta-lactamases. The correct answer is ticarcillin is contraindicated with administration of aminoglycosides. Question 51. A patient with a history of depression has been prescribed a monoamine oxidase inhibitor. Which dietary restriction should the nurse practitioner emphasize to prevent a potentially life-threatening reaction? A. Limiting caffeine intake. B. Avoiding foods high in tyramine. C. Reducing sodium intake. D. Eliminating dairy products. E. Restricting carbohydrate consumption. The correct answer is avoiding foods high in tyramine. Question 52. A 45-year-old patient with depression has a history of seizures. Which antidepressant should be used with caution in this patient due to an increased risk of seizures, especially at high doses? A. Mirtazapine. B. Amitriptyline. C. Paroxetine. D. Bupropion. E. Duloxetine. The correct answer is bupropion. Question 53. Which enzyme inhibitor is combined with imipenem to prevent its degradation by renal enzymes and ensure its effectiveness in treating a wide range of infections, including those caused by Pseudomonas species? A. Clavulanic acid. B. Cilastatin. C. Sulbactam. D. Tazobactam. E. Avibactam. The correct answer is Cilastatin. Question 54. What must be monitored when administering daptomycin? A. Creatine kinase. B. Transaminases. C. White blood cell count. D. Creatinine and BUN. E. Iron studies. The correct answer is creatine kinase. Question 55. Why is testosterone not given as oral medication? A. Slow absorption by the intestine. B. Rapid urinary metabolism. C. Slow urinary metabolism. D. Rapid hepatic metabolism. E. Slow hepatic metabolism. The correct answer is rapid hepatic metabolism. Question 56. All of the following statements about antiviral treatments for genital herpes are true except A. They can occasionally eliminate latent virus from the body. B. They reduce the duration and severity of outbreaks. C. They can decrease viral shedding and transmission risk. D. Daily suppressive therapy may significantly reduce the frequency of recurrences. E. Oral antiviral medications include acyclovir, famciclovir, and valacyclovir. The correct answer is they can occasionally eliminate latent virus from the body. Question 57. A 49-year-old woman with rheumatoid arthritis comes to the clinic. Despite taking the maximum dosage of NSAIDs, she continues to experience pain and morning stiffness with occasional discomfort during the day. She is interested in exploring a different medication. What is the most appropriate next treatment option? A. Methotrexate. B. Ketorolac. C. Acetaminophen. D. Unfortunately, there are no other alternatives. E. Indomethacin. The correct answer is methotrexate. Question 58. An MP is treating a patient with Parkinsonian symptoms and wants to target the nigrostriatal tract to improve extrapyramidal function. What is the expected outcome of increasing dopamine in the nigrostriatal tract? A. Improvement in Parkinsonian symptoms. B. Improvement in negative symptoms of psychiatric disease. C. Reduction in hallucinations and delusions. D. Increase in prolactin levels. E. Increase in nausea and vomiting. The correct answer is improvement in Parkinsonian symptoms. Question 59. Which of the following statements correctly describes the dual mechanism of action for cilostazol? A. Inhibits phosphodiesterase and adenosine uptake to increase CAMP levels and reduce platelet aggregation. B. Inhibits phosphodiesterase and increases adenosine uptake to increase CAMP levels and reduce platelet aggregation. C. Activates phosphodiesterase and reduces adenosine uptake to decrease CAMP levels and reduce platelet aggregation. D. Activates phosphodiesterase and increases adenosine uptake to increase CAMP levels and reduce platelet aggregation. E. Inhibits phosphodiesterase and adenosine uptake to reduce CAMP levels and reduce platelet aggregation. The correct answer is inhibits phosphodiesterase and adenosine uptake to increase CAMP levels and reduce platelet aggregation. Question 60. What is the mechanism of action for flutamide, and what condition is it used for? A. It is a competitive antagonist of androgen receptors and is used in the treatment of prostate cancer. B. It is a 5-alpha reductase inhibitor and is used in the treatment of benign prostatic hyperplasia. C. It inhibits androgen synthesis and is used in the treatment of polycystic ovary syndrome. D. It is an androgen receptor agonist and is used to treat muscle wasting conditions. A. It inhibits the conversion of testosterone to dihydrotestosterone and is used for the treatment of male pattern baldness. The correct answer is it is a competitive antagonist of androgen receptors and is used in the treatment of prostate cancer. Question 61. What is not a side effect of testosterone therapy in women? A. Aggression. B. Deep voice. C. Paradoxical feminization. D. Enlarged clitoris. E. Hirsutism. The correct answer is paradoxical feminization. Question 62. Dopamine antagonists can be used to decrease the effects of dopamine in order to improve symptoms of nausea and vomiting. Which of the following tracts is the likely primary target? A. Chemoreceptor trigger zone. B. Tuberoinfundibular tract. C. Mesocortical tract. D. Mesolimbic tract. E. Nigrostriatal tract. The correct answer is chemoreceptor trigger zone. Question 63. Which of the following is most likely to be seen in a patient using opioids for relief of acute pain after surgery? A. Addiction only. B. Drug tolerance and physical withdrawal upon cessation of the drug. C. Drug tolerance and addiction. D. Physical withdrawal upon cessation of the drug and addiction. E. Development of chronic pain. The correct answer is drug tolerance and physical withdrawal upon cessation of the drug. Question 64. Which statement regarding vancomycin is false? A. It is administered orally for luminal infections of the gut. B. It can be associated with severe cutaneous flushing. C. It binds to the alanine terminal of peptidoglycan in the bacterial cell wall. D. It can readily cross the blood-brain barrier. E. It is a glycopeptide and a cell wall synthesis inhibitor. The correct answer is it can readily cross the blood-brain barrier. Question 65. What is the primary mechanism of action of heparin in anticoagulation therapy? A. It blocks ADP receptors on platelets. B. It acts as a vitamin K antagonist. C. It prevents the activation of factor X. D. It directly inhibits thrombin. E. It increases antithrombin activity. The correct answer is it increases antithrombin activity. Question 66. A 60-year-old patient presents with severe anxiety and agitation in the emergency department. The patient has a history of chronic benzodiazepine use and is suspected of benzodiazepine overdose. Which of the following medications can be used as an antidote for benzodiazepine poisoning? A. Naloxone. B. Flumazenil. C. Thiamine D. Lorazepam. E. Phenobarbital. The correct answer is flumazenil. Question 67. Which of the following is not a route of administration of heparin? A. Intravenous. B. None of the options is correct. C. Oral. D. Subcutaneous. The correct answer is oral. Question 68. What is not a side effect of testosterone therapy? A. Increased hematocrit. B. Headache. C. Positive nitrogen balance. D. Virilization. E. Osteopenia. The correct answer is osteopenia. Question 69. What is more likely a side effect of meperidine than other opiates? A. Meiosis. B. Respiratory depression. C. Less dopamine stimulation. D. Seizures. E. Sedation. The correct answer is seizures. Question 70. Which of the following directly inhibits factor XA in the coagulation cascade and is known for its predictable dosing without the need for routine blood monitoring? A. Rivaroxaban. B. Heparin. C. Warfarin. D. Dipyridamole. E. Tissue plasminogen activator. The correct answer is rivaroxaban. Question 71. Regarding cephalosporins, which statement is true? A. They inhibit protein synthesis. B. They inhibit dihydropteroate synthase. C. They are more susceptible to penicillinase than other penicillins. D. They are used as fungal and bactericidal drugs. E. They inhibit the synthesis of the bacterial cell wall. The correct answer is they inhibit the synthesis of the bacterial cell wall. Question 72. Which vitamin can be used to reverse the anticoagulant effects of warfarin? A. Vitamin K. B. Vitamin A, C. Vitamin E, D. Vitamin C. E. Vitamin B12. The correct answer is vitamin K. Question 73. Which of the following formulations is preferred for the treatment of iron deficiency anemia in most patients? A. Oral iron. B. Intravenous iron. C. Intramuscular iron. D. Rectal iron. E. Intranasal iron. The correct answer is oral iron. Question 74. The function of which system in an elderly patient should be monitored before prescribing an NSAID? A. Renal. B. Respiratory. C. Gastric. D. Cardiac. The correct answer is renal. Question 75. What is the mechanism of action of bivalirudin? A. Direct thrombin inhibitor. B. P2Y12 receptor blocker. C. Activation of antithrombin. D. Factor X inhibitor. E. Vitamin K antagonist. The correct answer is direct thrombin inhibitor. Question 76. For a patient with osteoarthritis experiencing moderate pain, which is considered a first-line treatment due to its safety profile despite being less effective than NSAIDs. A. Acetaminophen. B. Tramadol. C. Corticosteroid injections. D. Methotrexate. E. Hydroxychloroquine. The correct answer is acetaminophen. Question 77. What is the recommended antibiotic treatment for Trichomonas vaginalis? A. Metronidazole. B. Azithromycin. C. Fluconazole. D. Doxycycline. E. Acyclovir. The correct answer is metronidazole. Question 78. Benzodiazepines bind with which subunit of the GABA receptor? A. Delta. B. Gamma and beta. C. Gamma. D. Delta and beta subunits. E. Between alpha and gamma. The correct answer is between alpha and gamma. Question 79. Why is bacitracin not used parenterally? A. It results in severe histamine release, leading to red man syndrome. B. It requires oxygen to be active as a bactericidal agent. C. It is markedly nephrotoxic when taken parenterally. D. It causes severely elevated levels of creatinine kinase. E. Enzymes in the blood break it down before reaching its target. The correct answer is it is markedly nephrotoxic when taken parenterally. Question 80. A woman comes to your clinic for a legal abortion at 8 weeks gestation. You recommend a combination of mifepristone and misoprostol. What side effects are you not concerned with when treating patients with this regimen? A. Nausea. B. Cramping. C. Hirsutism. D. Vomiting. E. Bleeding. The correct answer is hirsutism. Question 81. A patient presents with a community-acquired respiratory infection. Which macrolide antibiotic is commonly used for this condition due to its broad-spectrum activity, excellent tissue penetration, and relatively slow elimination? A. Erythromycin. B. Clarithromycin. C. Azithromycin. D. Telithromycin. E. Fidaxomicin. The correct answer is azithromycin. Question 82. How does allopurinol contribute to the management of gout? A. It decreases urate production. B. It increases urate excretion. C. It inhibits leukocyte migration. D. It blocks the action of interleukin-1. E. It inhibits urate absorption. The correct answer is it decreases urate production. Question 83. Which of the following tetracyclines can be used in the management of antidiuretic hormone secreting tumors? A. Minocycline. B. Doxycycline. C. Tetracycline. D. Tigecycline. E. Dimeclocycline. The correct answer is dimeclocycline. Question 84. A patient presents with a severe cutaneous reaction characterized by diffuse flushing following vancomycin administration. The nurse practitioner recognizes this reaction as A. Stevens-Johnson syndrome. B. Erythema multiforme. C. Red man syndrome. D. Urticaria. E. Drug rash with eosinophilia and systemic symptoms. The correct answer is red man syndrome. Question 85. Which of the following antimicrobial agents has the strongest activity against gram-negative organisms? A. Methicillin. B. Nafcillin. C. Ampicillin. D. Amoxicillin. E. Piperacillin. The correct answer is piperacillin. Question 86. Which part of the cell do the hormones bind to the estrogen receptors in selective estrogen receptor modulators? A. Rough endoplasmic reticulum. B. Ribosomes. C. Lysosomes. D. Nucleus. E. Smooth endoplasmic reticulum. The correct answer is nucleus. Question 87. Initial inhibition of which factor by warfarin leads to its immediate procoagulant effect? A. Factor X. B. Factor 2. C. Factor 9. D. Factor 7. The correct answer is Factor 7. Question 88. How long after last use do symptoms of opioid withdrawal occur? A. 3 for hours. B. 6, 8 hours. C. 11, 15 hours. D. 16, 20 hours. The correct answer is 6, 8 hours. Question 89. For the first 8 weeks of taking tamsulosin, what time of day should it be taken? A. With the last meal of the day. B. Bedtime. C. Noon. D. Before breakfast. The correct answer is bedtime. Question 90. Which test must be performed prior to the administration of thrombolytics in a person with a suspected ischemic stroke? A. Head CT without contrast. B. Head CT with contrast. C. Platelet count. D. International normalized ratio. E. Cardiac biomarkers. The correct answer is head CT without contrast. Question 91. A previously healthy 24-year-old man is diagnosed with gonococcal urethritis based on symptoms and a urethral smear. What is the best treatment for this patient? A. A single oral dose of azithromycin. B. A 7-day course of oral azithromycin. C. A single intramuscular dose of ceftriaxone. D. A single intramuscular dose of ceftriaxone and 7 days of oral doxycycline, 100 milligrams twice daily. E. A single intramuscular dose of ceftriaxone and a 7-day course of oral azithromycin. The correct answer is a single intramuscular dose of ceftriaxone and 7 days of oral doxycycline, 100 milligrams twice daily. Question 92. A 19-year-old male sports enthusiast presents to your psychiatry clinic with his family because of repeated outbursts of anger resulting in police involvement. On physical exam, he is very well muscled with moderate acne on his face and back. What is the highest on your differential? A. Anabolic steroid use. B. Psychotic episode. C. Glucocorticoid use. D. Antisocial personality disorder. E. Delayed puberty. The correct answer is anabolic steroid use. Question 93. Cyclosporin is a very useful medication to prevent organ transplant rejection. What is required when prescribing this medication? A. Patients must take folate with this drug to ensure some normal cell development. B. Patients have to get their creatinine levels checked regularly. C. Patients must be monitored for lung fibrosis. D. Patients must have their hearing checked periodically. E. Patients must take vitamin B6 to prevent peripheral nerve damage. The correct answer is patients have to get their creatinine levels checked regularly. Question 94. Which vitamin is antagonized by warfarin? A. Vitamin D. B. Vitamin C. Vitamin B1. D. Vitamin K. E. Vitamin E. The correct answer is vitamin K. Question 95. Which statement is most accurate regarding the comparison between alteplase and streptokinase? A. Alteplase is contraindicated in myocardial infarction, while streptokinase is not. B. Alteplase has a lower risk of intracerebral hemorrhage. C. Alteplase shows an affinity for fibrin-bound plasminogen, while streptokinase does not. D. Alteplase is more widely used worldwide. E. Alteplase has a lower cost. The correct answer is alteplase shows an affinity for fibrin-bound plasminogen, while streptokinase does not. Question 96. Which of the following is the most appropriate treatment for a gout attack in patients with renal insufficiency? A. Intra-articular steroid injection. B. Allopurinol. C. Celecoxib. D. Ibuprofen. E. Indomethacin. The correct answer is intra-articular steroid injection. Question 97. Estrogen use increases the risk of which condition? A. Color blindness. B. Liver cancer. C. Osteopenia. D. Skin hemangiomas. E. Endometrial cancer. The correct answer is endometrial cancer. Question 98. A nurse practitioner is consulting with a surgeon to determine the appropriate prophylactic antibiotic for a patient who is scheduled to undergo surgery. Which first-generation cephalosporin, known for its superior efficacy against gram-positive bacteria, should be selected for this purpose? A. Cefepime. B. Cefuroxime. C. Cefaclor. D. Ceftazidime. E. Cefazolin. The correct answer is cefazolin. Question 99. A 10-year-old child diagnosed with ADHD has not shown adequate improvement while being treated with the stimulant methylphenidate. The nurse practitioner is considering an alternative non-stimulant option. Which of the following medications would be a suitable choice for this patient? A. Diphenhydramine, an antihistamine. B. Aripiprazole, an atypical antipsychotic. C. Risperidone, an atypical antipsychotic. D. Sertraline, a selective serotonin reuptake inhibitor. E. Atomoxetine, a norepinephrine reuptake inhibitor. The correct answer is atomoxetine, a norepinephrine reuptake inhibitor. Question 100. What is an indication to prescribe a barbiturate? A. Hypotension. B. Extubation. C. Depression. D. Narcolepsy. E. Seizure control. The correct answer is seizure control.